Are you tired of living with arthritis pain? Come explore the world of cell-based therapies to help relieve you of your pain. You got pain in your knee? This is Dr. P, otherwise known as Dr. Mark Petropoli. And today we're going to do a little talking about, quote, stem cell therapy. So first of all, what are stem cells? Stem cells are cells that are inside of our body, usually most commonly in the bone marrow, but you actually have some in your fat, believe it or not. So people do sometimes harvest stem cells from the fat. And stem cells are cells in general that haven't turned into anything yet. Bone marrow has all kinds of different cells in it, okay? It has stem cells and it has other cells that help the stem cells, things like monocytes and things like that, and it also has blood and growth factors in it. Now, the advantage of bone marrow cells is there's two different types of stem cells. There's hematopoietic and there's mesenchymal. I know those are big words, but hematopoietic just means it's going to turn into a blood cell, like a red blood cell, white blood cell, cells that are in your blood. And mesenchymal means it can turn into cartilage, bone, heart, lungs, liver, whatever. So it has both of those. So technically, especially in a lab, but technically a stem cell can turn into cartilage, it can turn into tendon, it can turn into bone, it can turn into heart, lung, skin, all kinds of different tissues. So technically a stem cell hasn't turned into anything yet. And so theoretically, if we took some of your stem cells and we injected them into a place that was injured, it would theoretically grow back everything and you would be back to new. But that's not exactly how it works. So first of all, as far as doing actual quote-unquote stem cell injections, we're not technically allowed in the United States to take your stem cells from your bone marrow, for instance, send them off to a lab, mail them, grow them, multiply them, and then mail them back and inject them back into you. That's not allowed in the US right now. We're also not allowed to use somebody else's stem cells, but that's fine. I'd rather have you use your own stem cells anyway, and that's what I've always done. There's no chance of rejecting them. It's safer. You know, we are allowed, however, to take your own cells from your bone marrow, which has stem cells and other cells that help the stem cells, in addition to growth factors and other things that help your stem cells. And we're able to take them with a special needle and concentrate them and then inject them into the area that has the damage. I have a trademark called knee repair, not knee replacement, but we use it for other joints and other areas as well. So we are allowed to take your own bone marrow, we are allowed to concentrate it or use a special needle that concentrates it and inject it back into your body, okay? So the advantage of that is we're using your own cells. We're not allowed by the FDA to use somebody else's cells. That was allowed for a short period of time. Things like umbilical cord cells, placenta cells, those were allowed for a short period of time, and there's no definitive proof that they're any better than your own cells anyway. Probably not, at least at this point, but right now the FDA does not allow that. So if you see somebody advertising for that, technically that's not FDA approved, and there are still some people who are using that. But the advantage of using your own tissue is it's your own tissue, so you're not going to reject it. It's much safer. So for instance, if we're talking about arthritis, arthritis is nothing more than the cartilage on the end of the bone wearing down. So if you recall from some of my previous videos, and if you haven't seen them, go click on them. But arthritis is where the cartilage wears down on the end of the bone. So in a knee, for instance, we have a thigh bone, we have a shin bone. And there's cartilage on the end of the bone. It looks kind of like the weight on the end of a chicken bone, and that's kind of like the tread on a tire. When that tread wears down, that's what arthritis is. So people think that if we just take stem cells or bone marrow cells and inject them into a joint, that it's going to grow back cartilage. And there is some evidence that it can do some of that. But what is interesting is what really probably happens is stem cells, even though they can turn into other things, they're actually more of a boss cell or more of a cell that tells other cells what to do. So what they do is when we put them into the knee, for instance, they tell other cells, hey, you're not doing what you should do, or hey, you're lazy, you're sleeping, wake up, start doing this, start doing that. And I'm making an analogy here, but basically they tell other cells what to do. They're actually more like a messenger cell. Having said that, they still, even after they do all the messaging and bossing, they can still turn into a cartilage cell or into a muscle cell or into a tendon cell. So they're pretty amazing cells. I like to make it more analogous to that show Fixer Upper, where you have a house that's kind of crappy looking, it doesn't look good, it doesn't work good, it doesn't feel good, and it just doesn't function well. So they come in and they fix it all up, and it's the same house, but when they're all done with it, it looks better, it feels better, it functions better, but it's the same house. Well, that's kind of what stem cells do. And again, this is an analogy, but that's kind of what they do into areas that are damaged that we inject them into. Interestingly, if you have an injury to an area, we have stem cells along all our blood vessels, our capillaries, and so those stem cells go into action, and they also call other cells into action, and that's kind of how the body works. It's very, very complicated, and hence stem cells are great, or bone marrow cells, or adipose cells, cells from fat, but they're not the end-all be-all. So there's a lot more that goes into it. And so today I'm just talking about stem cells, but when we see somebody, we treat them with a multifaceted approach, a whole body, a total person approach, and that is going to include the biologics, which stem cells are one of them. There's also plenty of videos I have on PRP, platelet-rich plasma. The platelets are those things when you cut yourself, you form a scab, they stop the bleeding, and they have growth factors. So platelets are kind of like fertilizer, but we can get into that. But the biologic things like the bone marrow cells, the PRP, but losing weight, when we walk, we land with about 2 or 3 or 4 times body weight. If you run or jump, that can be up and down stairs, that can be 10 or 12 times body weight. So we have a total comprehensive package. It may include weight loss if you need weight loss. It may include nutrition if you need nutrition. By the way, genetic-based nutrition. So analyze your DNA, figure out what actually is the best plan for you, not just kind of, hey, everybody should be off carbs and everybody should be eating tons of protein. That doesn't actually work for everybody. So we have a whole program for that. Also, laser therapy, yes, lasers can actually help healing. They're not just used for cutting. There are surgical lasers for eye, and we use surgical lasers in the knee to cut things out, but these are healing lasers, and we have a whole series of videos on that. So yes, stem cells are amazing, but just in and of themselves, they're not the end-all be-all. They are amazing, but we take more of a whole body approach, and I have other videos on that, including a trademarked process called knee repair, not knee replacement. So we'll get more into that, but if you like this video, click like, subscribe, and please watch our other videos, and please leave comments. Either we'll answer them or make new videos answering your questions. So thank you and have a great day. Remember, you got a problem with your knee? Call Dr. P.